Hello, everybody. My name is Enrique Arellano. I'm the director of the Four Cycles Institute in Barcelona, Spain, and I have the great honor to have as a guest with us Dr. Roger Solomon, who is a distinguished psychologist and international recognized trainer and expert in EMDR. Dr. Solomon has dedicated his career to the profound and often challenging topics of grief and mourning, integrating his insights into the therapeutic approach of EMDR. His book, EMDR in Grief and Mourning, now in Spanish, El Tratamiento del Duelo con EMDR, has become a vital resource for clinicians seeking how to support and navigate the complexities of loss for any human being who has experienced grief and mourning. With decades of experience and commitment to understanding human resilience, Dr. Solomon's work has transformed clinical practice, but also provided invaluable tools for those who struggle to work with their clients to heal from grief. Today, we have a chance to speak with him and his professional contribution and the profound impact of his work on the world of trauma therapy. Welcome, Roger. How are you today?
Oh, very well. And it's wonderful to be able to talk with you and everybody.
Yes, you were recently in Madrid and you were also last year in Barcelona. And many people already have had the privilege of training with you in the past and in the present.
And yes, I had a wonderful time in both places. I just got back from Madrid a couple of days ago. So
Yes. So I also want to thank the EMDR communities in Spain, all of them, for supporting Dr. Roger Solomon in his work. So, Roger, could you share with us a bit about your journey into the field of psychology and what initially drew you to EMDR?
and so I was always interested in psychology and working with people. And I obtained my doctorate in clinical psychology, and my first job, full-time job, was working with police officers. I was the police psychologist in Colorado Springs, Colorado, and was especially interested in psychological trauma. And at that time, I met an FBI agent from the Denver field office, Jim Horn, who was researching what we then called post-shooting trauma. And we started developing programs for police officers. Around this time, also, programs were developing for families of police officers that were killed in the line of duty. And so I started working with trauma 1979 and started working with families of police officers killed in the line of duty through an organization called Concerns of Police Survivors in 1986.
Wow.
And I learned EMDR therapy in 1990 and immediately started to apply it with police officers, other people involved in trauma, and of course, to the families of police officers that were killed in the line of duty. And immediately I could witness the positive and transformative effects of EMDR therapy with trauma and with grief. So that was over 3 decades ago, my start with EMDR therapy, and I am still learning, and I am still awed, just in awe of the therapeutic results and movement that we get with EMDR therapy.
Absolutely. Thank you so much. This is so important. And I read in your book that in working, of course, through your experience and EMDR, that you integrated teachings and work on grief and also teachings and work on attachment theory and how that it impacts the survivors or you know the individuals who have survived some loss that happened to them. So, could you elaborate a bit about,
Yes.
the studies
Yeah.
of grief and how you took some elements of this or elaborated with your own experience to develop what you did and your work with attachment subsequently?
Yes. So research has demonstrated that the variance in grieving, the variance in mourning, is due to our attachment orientation, our attachment style. So let's starting with the basics. Attachment is not love. Attachment is safety. As human beings, infants, we are wired to attach to a caregiver for safety. And if there's good enough comfort and soothing, when there's distress, a secure attachment develops. But if the comfort is not there or is inconsistent, then some insecure attachment styles develop. The parent who can sometimes provide comfort and sometimes not can leave the child feeling very anxious when the parent leaves. This is separation anxiety. And if there's a parent who is critical and shaming or just absent, then the best way to survive is to shut down the attachment style. And this is the precursor to an avoidant attachment. And when you have a parent, the source of safety is also the source of terror, is when we see disorganized attachment, which underlies complex trauma and dissociation. So our attachment system is stimulated when there is some danger. When someone we love, someone we're close to dies, of course we are upset. It's going to evoke our attachment system, our need for connection, for safety. But now this person is no longer there. So this loss can start to activate earlier distressing memories from childhood having to do with separation distress. So a person that has an anxious or ambivalent attachment style will start to feel anxiety, will ruminate about the loss, very much missing the person. A person with an avoidant attachment style attempts to shut down the emotions, because that's their style in dealing with distress that they've learned for survival. And somebody with disorganized attachment can alternate back and forth between the attachment system being overly activated and the attachment system shutting down. So in short, a loss can start to activate unresolved childhood memories having to do with separation distress. So complicated grief, complicated mourning results from, previous unresolved trauma and losses, but also these attachment-based memories.
Yeah, thank you so much. I think this is such a great contribution for EMDR, as EMDR is a highly structured intervention. And with your work, I assume clinicians trained in EMDR learn to see their clients and their attachment relationship, and maybe also the adverse childhood circumstances and how early childhood trauma is present, especially more so in times of great loss, complicated mourning. And I think this is a great contribution to bring into such an efficient and highly structured intervention like EMDR, to bring in all the richness from attachment theory and how that impacts the clients. And this is great. And I'm also curious to ask you, there's a lot of work also around people who are grieving necessitate some kind of special attention, isn't it? It's not working with other situations like anxiety and depression. It's something more that we need to learn when working with somebody who's grieving, who, like you just said, who has
Mhm.
lost a significant one.
Mhm.
I don't know if I'm being redundant, but I have that question for you.
Well, sure. Well, EMDR therapy, it's actually a very flexible procedure.
Yes,
When people first take the basic training and they get the manual, it can seem like it might be very, very structured because
yes,
there's so much to learn, so many choice points. We give you the manual and say, all right, why don't you read it? So you don't lose your place, and you don't have to have things memorized, and that way you can focus on the process. But as you come to integrate the standard protocol, you really see how flexible it is and how you can adapt it to your client.
exactly.
Now, EMDR therapy is a therapeutic approach that can integrate in other therapeutic approaches. And
Absolutely.
so we need to have special understanding of our clinical population to best apply EMDR therapy. So EMDR therapy can be guided by other frameworks.
That's so important what you're saying. Thank
Mm.
you. Thank you so much.
So there's frameworks that I talk about in the book, and it's not an exhaustive list. For example, attachment theory is certainly relevant to how we grieve, as I talked about.
Exactly.
Another framework that guides us is called continuing bonds. And this theory says that we don't lose our connection, our attachment to the person who dies. It evolves.
Mm.
Psychoanalytic thinking in the beginning, thought that there had to be the withdrawal of psychic emotional energy in order to be able to connect with somebody else later. But research has shown we don't lose or take back that connection energy. It transforms. So that's continuing bonds. And this is very important in EMDR therapy, because what happens is that we start working with the trauma of the loss. And again, the realization of the permanence can be very distressing. But what starts to happen as we process the trauma is the linking in of adaptive information. And this is usually in the form of positive, heartfelt moments and memories.
Wow.
So the person, the mourner, after working through the trauma, can start to feel a connection to the loved one through these memories.
Wow.
Now, this is not a new concept. All the books will tell you that how we grieve is we're able to remember the person, feel them in our hearts, And of course, EMDR therapy, being a natural process, results in this outcome.
Yeah.
It's just something that we can see happening quite efficiently.
Yeah. I love what you said and how this is integrated. And I think many people will benefit from your perspective and your as a master or senior trainer or pioneer also in your work, how this needs to be imbibed, how EMDR can fit other treatment models, how people can use the framework, and that insight of the continuing bonds is so precious to take with us.
Mm-hmm. And other frameworks that are important is one's called the dual, DUAL process model.
Dual process, yes.
Mm-hmm. And Strobe. And what this model states is that we experience two orientations. A loss orientation, we feel the grief, the loss, the pain. We have to do that grief work. But there's also a restoration orientation. There are times we have to put the grief aside so that we can focus on dealing with the tasks and challenges in real life that are posed by the death. So when somebody dies, there's many changes that need to occur in our life. So that's the restoration orientation. So healthy grieving is alternating between doing a grief work, that loss orientation, where we feel and work through the pain,
Yeah.
and oscillating to the restoration orientation.
Yeah.
We are able to deal with the secondary losses, deal with the life challenges in adapting to the loss. So this oscillation has to be in balance. And what this tells us is that we need to assess if the client is in balance. And of course, it's connected to attachment. Somebody that has an insecure, anxious, or ambivalent attachment style can get stuck in the loss orientation and needs help to process the loss so they can start to operate better in everyday life to adapt. And somebody with an avoidant attachment style can be stuck in restoration orientation, focusing on externally and not able to focus on the loss. So observing the balance is very important and helps us plan interventions.
Exactly. In your book, you also talk about Terry Rando's processes. Could you talk about a bit?
Yes, that may be the longest chapter. Terry Rando and I have written maybe 3 articles starting in the actually started doing some presentation, and that would have been in the late 90s and so on. So Terry Rando writes about what's called the R processes, because in English, the name of each process begins with the letter R. And these are processes that are important for adaptation. So, for example, first there's an avoidance phase. When somebody experiences a loss, especially when it's sudden and unexpected and violent, which these are risk factors, it can be a significant shock and the need to avoid. So the first task we need to do, the first process, is recognize the loss. Need to understand what happened and its implications.
Yeah.
At some point, though, we need to experience the emotional impact. There is that confrontation phase. And the second phase, we react to the loss. We have to feel, identify, feel, and express our reactions to the loss. Not just the primary loss of the person, but also the secondary losses as well. Or the partner dies and now half the income is gone. The family has to move. These are secondary losses.
Yes.
A third process is to remember. We have memories of the loved one, and we have to remember realistically. So there were good memories, there were negative memories, and we are reviewing the relationship through these memories. This is how we get in touch with the significance of our relationship. So we react and have feelings about the loss, but we review as we remember.
Beautiful.
Memories are, having the memories are very important. And of course, where EMDR comes in is that the memories are not always good memories.
Yes.
Get to that a little later.
Yes.
And the fourth and fifth process, again, very important. A person has to relinquish the old attachments to the old world. It's no longer valid. Our loved one is not here. They're not in our life, our everyday life anymore. So, which is, again, very difficult to relinquish the old ties.
Oh, yes.
But we then, again, we don't lose the connection, okay? What happens is we readjust to the new world without forgetting the old. So there is that adaptation. We relinquish the old, but adapt, readjust to the new world as well.
That's so much richness. Yeah.
Mm-hmm. And in readjusting, then we can again reinvest in life, and that's the sixth phase. We can reinvest.
That's amazing. I have to look on those two last ones. They are really pivotal as well as the first.
Yeah. So those are the R processes. It's not a stage theory. It's very flexible. People go through these processes in their own way and can be going back and forth. But it is a model to help us understand where the mourner is or where the mourner may be stuck.
Yeah, you're providing such a complete framework for the clinician to orient in the work, in assessing the client, and also providing how to integrate all of these into the 8 phases of the EMDR therapy. In the book is the fourth part of the book. Yes, such a great book you wrote, and so positive that people who have taken the training have benefited from this, and reading the book is such an important feature of really imbibing all your lessons and your broad view and going through all these steps. Thank you. I'm wondering, I think this is a contribution you're making to the EMDR world and to the therapy of grief as well. What's your sense of what it has meant for you to bring this about, this life trajectory into this grief and mourning EMDR?
Well, first of all, I still find EMDR an amazing therapeutic approach.
It is.
And again, I'm continually in awe when working with grief, with loss issues. What happens often, as I said before, is that we're able to process the trauma of the loss, which enables positive, meaningful memories to come in, giving a person a sense of connection to the loved one. And that's why the subtitle to my book is Transformation of the Attachment to the Loved One.
Exactly.
And also, again, with EMDR therapy too, we can see the resolution of the trauma, to traumatic events or the trauma of the loss. So again, we can target and reprocess the trauma of the loss to enable and facilitate adaptation to the new world, because the loved one can bring that a new representation into their new world. So we don't lose the connection. It transforms. So again, studying and understanding this process and over the years, just learning how to maximize the impact of EMDR therapy to achieve and facilitate adaptation. For me, I think of it as meaningful joy, and that's what this work is for me. It's meaningful joy.
Yeah. Thank you for this. This is how you come across to me, as somebody spreading joy in some way. And I thank you so much. Such a great honor and privilege to get to know you and get to understand how you have come to do this amazing work. And I'm glad the book is now out, also in the Spanish language. And well, I'm out of questions, I think.
Okay.
Because we could go deeper into this conversation, but I think I really want to encourage the people who are watching to get the book and take some time to read it and go through it. And possibly, if you can, go and train with Roger.
Yes.
Okay, thank you so much.
We'll stay in touch.
How was that?